Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, we are discussing ESIC previous year questions and answers. Till now we completed 5 parts. Again, today we can discuss another set of questions. Surely these questions will helpful for your coming exams. So you have to focus the area, the topic which I am focusing and cover all the areas. The first question, function of an emergency trolley drug epinephrine for a shock patient. This question from ESIC question 2010. Options: option A, increase cardiac activity, option B, improve consciousness, option C, tachycardia, option D, reduce cardiac output. So here our question, why we are using or what is the function of this epinephrine drug for shock patient? Okay, here answer is option A, increase the cardiac activity. Epinephrine can increase the cardiac activity by increasing heart rate and force of contraction. So this epinephrine can increases the cardiac activity by increasing the heart rate and force of contraction. Here option A is the correct answer. The next question, deficiency of oxygen into an unconscious shock patient checked by the nurse through which sign? Options: option A, cyanosis, option B, difficulty in breathing, option C, bradypnea, option D, numbness. Question, oxygen deficiency of an unconscious patient can check by using cyanosis. Option A is the correct answer. Cyanosis means it's an bluish discoloration of the lips, skin, nail buds. Okay, so here in an unconscious patient easily we can check first sign, we can check by cyanosis. Option A is the correct answer. And the next question, which of the following drug increases peripheral vascular resistance? Option A, adrenaline, option B, dopamine, option C, atropine, option D, nitroglycerin. Which drug can increase the peripheral vascular resistance? Correct answer is option A, adrenaline. Drug adrenaline can cause vasoconstriction. So we can use it for increasing the peripheral vascular resistance. Option A, adrenaline is the correct answer. Move on to the next question. Penicillin was the first antibiotic to be used clinically in option A 1940, option B 1941, option C 1945, option D 1951. Penicillin was first used clinically in 1941. Option B is the correct answer. Move on to the next question. Which gas is commonly used in laparoscopic surgery? Options: option A, nitrogen, option B, carbon dioxide, option C, hydrogen, option D, oxygen. The gas commonly used in laparoscopic surgery is carbon dioxide. Option B is the correct answer. Move on to the next question. Most common type of episiotomy is? Options: option A, J-shaped, option B, median, option C, mediolateral, option D, lateral. Most common type of episiotomy is option C, mediolateral. Episiotomy or peritoneotomy is the surgical incision of perineum and the posterior vaginal wall. And the most common type of episiotomy is mediolateral episiotomy, and the episiotomy is mainly performed during second stage of labor. The next question, the ear bones that transmit the vibration to cochlea are situated in? Options: option A, middle ear, option B, inner ear, option C, outer ear, and option D, eustachian tube. Correct answer is option A, middle ear. The ear bone which is located in the middle ear that will help to transmit vibration to cochlea. The next question, fluorescent angiography of the eye allows the study of the circulation of? Option A, choroid, option B, retina, option C, both A and B, option C, iris. Correct answer is both A and B. Fluorescence angiography of the eye allows the study of choroid and retinal circulation. The next question, which of the following is not a typical difference factor between benign and malignant tumor? Options, option A growth rate, option B encapsulation, option C cell differentiation, option D size of the tumor. Correct answer is size of the tumor. It is not a difference factor in case of both benign and malignant tumor. The next question, which of the following is used in colonoscopy? Options, option A providonidine, option B acetic acid, option C methylene blue, option D gentian violet. Which substance is used in colonoscopy? Correct answer is option B acetic acid. Colonoscopy means is the visualization of colon or large intestine. The next question, an eating disorder in which binge eating is followed by depression and guilt, self-induced vomiting and purging is known as. Option A anorexia nervosa, option B bulimia nervosa, option C dysphagia, option D binge eating disorder. Correct answer is bulimia nervosa. This bulimia nervosa is also known as binge-purge syndrome. That means there is a binge eating. Binge eating means overeating followed by depression and guilt and self-induced vomiting and purging is the characteristic features of bulimia nervosa. It is one of the eating disorder. The next question, the drug of choice to treat bulimia nervosa is option A antidepressants, option B glucose 10%, option C benzodiazepine and option D thiamine. Drug of choice to treat bulimia nervosa or overeating is antidepressants. Option A is the correct answer. And the next question, irrational and intense fear of traveling is known as. Options, option A agoraphobia, option B hodophobia, option C acrophobia and option D aerophobia. Intense or irrational fear of traveling is known as hodophobia. Option B is the correct answer. Move on to the next question. A patient not willing to go outside alone with fear of doing something crazy in public is known as. Option A agoraphobia, option B social phobia, option C acrophobia, option D claustrophobia. And the correct answer is option A agoraphobia. Agoraphobia means fear of place away from some familiar situations or from home or some open places. Here patient is not willing to go alone in outside with fear of doing something crazy in public. That is known as agoraphobia. Option A is the correct answer. The next question, which of the following is considered to be most effective treatment of choice for phobia dysphobic disorder? Options, option A psychoanalysis, option B interpersonal psychotherapy, option C behavior therapy and option D family therapy. Correct answer is option C behavior therapy is the most effective treatment of choice for phobic disorder. Phobia means an irrational fear. Okay. Move on to the next question. What is the typical age for onset of anorexia nervosa? Options, option A 8 to 10 years, option B 10 to 12 years, option C 14 to 16 years and option D 18 years and above. Typical age for onset of anorexia nervosa is option C 14 to 16 years. Anorexia nervosa is also a eating disorder that the patient or person is not taking food or refuse to eat. Bulimia nervosa means it's an overeating. Average age for onset of anorexia nervosa is 17 years. That is between 13 to 19 years. Here option 14 to 16 years is there. So that is our correct answer. And also it is seen in young age till 26 years. The next question, the nurse anticipate that initial treatment of an adolescent with anorexia nervosa should specifically include options. Option A, family psychotherapy sections. Option B, correction of electrolyte imbalance. Option C, separation from family members. And option D, medication to reduce anxiety. Correct answer is option B, correction of electrolyte imbalance. Anorexia nervosa means patient is refused to take food. So once the patient is continuously not taking food means that will affect the health. So can occur dehydration, electrolyte imbalance, especially hypokalemia and all, and anemia can occur, then risk of infection. All those things can lead to cardiovascular complication also occur for this patient, anorexia nervosa patient. So in our option electrolyte imbalance is there, so we have to maintain the electrolyte, so thereby patient can maintain the body status or health status. Okay, here electrolyte imbalance is the correct answer. And the next question, which of the following medical condition is commonly found in client with bulimia nervosa? Options, option A, allergies, option B, cancer, option C, diabetes, and option D, hepatitis. And correct answer is option C, diabetes. Bulimia nervosa means it's an overeating. Okay, here consequently it can lead to one of the medical condition, diabetes. Option C is the correct answer. And the next question, the fluid preferred for initial resuscitation of a patient with hemorrhagic shock is options. Option A, ringer lactate. Option B, 5% dextrose. Option C, fresh frozen plasma. Option D, whole blood. And the correct answer is option A, ringer lactate. Crystalloid solutions like RL and isotonic solution like NS is the first line for treatment of choice in case of this hemorrhagic shock. The next question, movement of the baby felt by the mother is known as option A, lightening, option B, engagement, option C, quickening, option D, ballotment. The first movement felt by the mother, movement of the baby felt by the mother is known as quickening. Option C is the correct answer. These are the today's question, and next video we can discuss next questions. Thank you for watching my channel. If it is useful for your studies, please subscribe my channel and share to your friends.